Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies. And I want to tell you a little bit about how we got to a custom knee replacement. And that's where a company called Conformis came in. They actually developed the techniques to be able to manufacture very rapidly an implant that matches the patient's shape and their size. And if you use a so-called off-the-shelf knee, they come in preset shapes and preset sizes, and the surgeon has to pick the best fit. Now, every implant manufacturer basically has one shape of their artificial knee. They come in different sizes, but they have one shape, and so then the surgeon is stuck with that shape. 80 to 85% of the time, the sizes fit and work out pretty well. 15 to 20% of the time, you're in between sizes. And that's not surprising that there's 15 to 20% of people who have residual pain and stiffness. When the surgeon is doing the operation and they're in between sizes, they have two choices. Choice number one is make the implant bigger. Choice number two is to make the implant smaller. They both have pros, they both have cons. The con, or if the surgeon chooses the bigger size, is that the knee will not bend as well, i.e. cause stiffness. The con, if the surgeon chooses a smaller implant, is that the implant will bend very well, but it won't be as stable. And so patients will feel that instability and they'll just subconsciously protect their knee and they won't get the same degree of recovery, and therefore they get both the pain and the stiffness as a result. With the Conformis knee, we never have that issue. The implant is made for you. The manufacturing technique is based upon a CAT scan, so it's very accurate. You get a perfect shape match and you get a perfect size match. That all sounds great, but on top of that, we actually have cutting tools that we use that are 3D printed. They're made specifically for you too. They're like Legos. They snap onto your bone and they go in the right spot every single time. The surgeon has to almost be an idiot to get it wrong. And I say that as a surgeon who helped design it and has been involved in all the various iterations of improving the instrumentation. We've gotten to the point now where there's data that's been published by independent surgeons that shows that the accuracy is 100% of the time you get it within an error margin of 2 degrees. 2 degrees is the thickness of a human hair. That's pretty accurate. There's nothing else out there that gets it that accurate. And the other thing that we found is the way the knee moves is much more akin to how a normal knee moves when you compare the custom knee to the off-the-shelf knee. And that, I think, has to do a lot with matching the anatomical parameters of the knee. And then lastly, the last thing I would say is that there's this score that we use to measure how patients are doing. It's called a forgotten knee score. And that basically means people who've had an operation, had a knee replacement, and just don't remember which knee they had operated on because it feels that good. So for most off-the-shelf implants, the highest you can get is around 60%. With the Conformis now, we're seeing that 91% of patients are reporting that they've forgotten which knee was operated on. That's a really high satisfaction level. It's not perfect, but we're getting closer and closer every time.